Hi everyone, it's Maddie. Welcome back to my channel. Today is day 9 of Diabetes Awareness Month, November 9th, 2018. I hope you're having a good day. I hope everything's going well for you. And today's video is going to be a little bit more in depth and elaborating on severe cases of hypoglycemia, which we had talked about in my last video. So with that being said, today's question is, what is glucagon and when is glucagon used? So first of all, glucagon is a hormone that is basically the opposite of insulin. Insulin helps to bring blood sugars down to a normal range. If the blood sugars are too high where they should be. In a non-diabetic, basically, insulin brings the sugar down. And same with us too, because we take insulin manually. And in a non-diabetic, they have glucagon. If their blood sugar gets too low, glucagon will help bring their blood sugar back up to a healthy state. Well, unfortunately, as a diabetic, we no longer can produce insulin, so we have to take insulin manually. However, because we are manually controlling our own blood sugar, our risk of low blood sugar is much higher than that of a non-diabetic. In addition to that, some of us can still produce glucagon, but some cannot, because when the immune system kills off the beta cells that secrete insulin, they also kill off the communication cells in the pancreas that communicate to the alpha cells when to secrete glucagon. So it's very important for us to carry a glucagon with us no matter where we are. So, first of all, if you need glucagon, you're probably not going to be conscious, or you're going to be having such a low blood sugar that you can't cooperate to eat or drink anything to help raise your blood sugar. You might not be able to swallow because your blood sugar is too low. You might be so irritable and out of your right mind that you can't think to take a drink of juice or eat some sugar or whatever the case may be. So then you have to have somebody be able to administer this to you. Now, who should learn how to administer this? Somebody, for sure multiple people. But definitely people that you are around a lot with. Like for me personally, my mother knows how to administer this. My grandmother knows how to administer this, and my dad knows how to administer this. Very important. If they kind of forget all the steps on how to administer this, don't be rude and say, "Oh, you should remember." Well, retrain them how to use it, or let them watch a video on how to properly distribute the glucagon the right way, or go back and have them talk to your diabetes nurse or your diabetes educator or your diabetes healthcare provider on how to properly administer this, because they need to know exactly what to do and follow the proper precautions and steps in case you would ever be unable to treat your own low blood sugar and the blood sugars go too low. So when is it used? Again, typically you're not going to be the one administering it to yourself. You're either, from a low blood sugar, you're either going to be unconscious, you're not going to be able to swallow or eat anything, or you're going to get so unruly and uncooperative that you aren't in the right state of mind and you can't be able to eat or drink for yourself or make those decisions for yourself anymore. So at that point, anybody who recognizes that will have to immediately get this glucagon and inject it into your muscle. What does glucagon do? Like I said, it raises the blood sugar quickly. It is a hormone like insulin that tells your liver to release stored sugar back into the bloodstream. People think it's a shot of glucose. Well, the name glucagon obviously has something to do with glucose, but it's not a shot of glucose. It is a hormone that tells your liver to release glucose. The way I help remember glucagon versus insulin, glucagon is for when the glucose is gone in your blood, and insulin is for when there's too much in the bloodstream. If there's too much in the bloodstream, you need insulin. If there's there's not enough glucose and the glucose is gone, you need glucagon. So that's how I remember the difference between those two. There have been some people that have to use these. I hope you as a type 1 diabetic never ever have to use one. I have never had to use mine in the 3 months I have been a diabetic, but we have to keep this in our bags at all times just in case something were to happen. Sometimes, like I said, people can't tell when they're going low, and they need this life-saving hormone to keep them from going unconscious and dying. With that being said, the person who injects this should inject it into a muscle, and from there you should wait for them to respond properly. If they come to, you need to feed them right away, get their blood sugar even higher to make sure you're not going to have a risk of going low again. Call 911 if need be. Again, it's a whole list of things. If you want a specific video on what to do in an emergency situation, let me know. But it's fairly simple to administer. It looks kind of complicated, but it isn't. Very important that you get this renewed every year, because after 1 year, the powder and liquid solution that are in here to pre-mix the glucagon expire after a year or go bad, or are not as potent anymore. Kind of like our insulin should be tossed after 28 to 30 days, or it's not going to have its same potency and strength to control blood sugar. It's the same with this, but you replace this once a year. This stays at room temperature. I'll open it up so you can kind of see what it looks like. So you have the vial of the glucagon, and then you have the liquid here that gets injected, and then it's mixed and injected into a person's muscle. Why do you inject in muscle? Well, if you, as a diabetic, know, if you inject insulin into muscle, that's not good, because then you will have a low blood sugar quick, because muscle rapidly gets the whatever medication you injected into the bloodstream quicker. That's why insulin is typically injected into what they call subcutaneous tissue or fat, so it takes a little bit more time for it to get in, but not so slow that you don't get it. Glucagon you don't want to inject in fat, because you want it in as quick as possible. This person is either unconscious or ready to go unconscious and they can't think for themselves. You want it to go right in the muscle so that it gets in the bloodstream and gets the signal and the message to the liver as quickly as possible to get that blood sugar back up. So, anyways, I hope this helps you kind of understand what glucagon is, and, kind of why we use it and why it's important for us to have it. Like I said, I've never had to use one. I'm sure there are people that have had to use one. I always keep it with me in case, and periodically I'll ask the 3 or few people that know how to administer it to me if they want a refresher course on how it's used. Obviously, you can't administer this to yourself. You probably don't need it if you're going to administer it to yourself. This is only if you cannot take care of yourself in a low blood sugar state. Somebody else will administer this to you. So I always keep my 3 primary people on top of what to do in case this is a reaction or an accident with this, or, I pass out. What do you do? But what you can do too is this kit will expire for me in July. So once this kit expires, you can save your old kits for practice. So that's what's really cool is you can get like a piece of like plastic or piece of foam or whatever that you could pretend is the muscle, and you could have somebody, like, hey, I'm passed out. What do you think? What do you need to do? What would be the cause of my passing out, and what do you need to do? Then you can have somebody practice with the old kit and practice injecting into a piece of foam that pretends it's your muscle, so that they better know what to do in that kind of situation, and that they feel like they've got that hands-on training with the glucagon without having to waste the medicine. So that's why a lot of people save their old kits. I will be doing that. As years go on, I will save all my old kits and allow people to practice and see what to do. In case I happen to pass out from a low blood sugar. I hope I never have to deal with that. I usually catch my lows quite quickly, but again, you never know. Sometimes life gets busy, you forget, or you can't feel a low blood sugar for whatever reason, and you need something to get you back up quick. So obviously you can see right here on the kit it says a Glucagon emergency kit for low blood sugar. So only use this in low blood sugar. If you're in doubt, the reason why someone is passed out as a diabetic, don't assume that it's from something else. You're better off assuming that the blood sugar is too low, because you would rather make sure the blood sugar is high enough so that they're not going to die immediately from a low blood sugar. It takes longer for you to have problems from high blood sugars, even though they are scary too, than it is for you to have problems with low blood sugars, because low blood sugars are acute and quick, and once you're down, it doesn't take long for you to get down, like I had explained in my previous video, whereas if you're high, it might take quite a long while before you end up in the ketoacidosis stage. So anyways, I hope this helps you guys. Thank you so much for watching. Stay tuned for my next videos coming up later on this month. Until then, share this video, like, subscribe. I hope you're enjoying these. Everybody take care, God bless, and I hope you're having a good day. Bye now.